SDT is very well tolerated. It's very safe. There's no accumulation of chemicals or drugs. The only agent that's used is the plant-based sensitizer, sonosensitizer that I mentioned, that's put under the tongue, but it doesn't accumulate. So SDT can be done multiple times. In fact, generally with advanced cancers, we recommend 3 to 4 cycles. A cycle is generally 2 weeks treatment. In that 2 weeks, it's 4 days a week. And so we want to get in each cycle a minimum of 8 treatments. Generally, the more advanced the cancer, the more cycles is needed. So on average, 3 or 4 cycles. So it's safe, it doesn't build up, it's non-toxic. So one of the observations with SDT, so I've mentioned about a cycle being 2 weeks, but there's been some good studies to show that even beyond 2 weeks, that there is a benefit, and that's because it seems to stimulate the dendritic cells and the T cells. The dendritic cells are important for helping to identify abnormal cells. And the T cells, there are different types of T cells, but there's some called cytotoxic T cells that are important to hone in and kill the tumor cells. So you have this sort of combined synergistic sort of partnership of immune cells that help to find the tumor, the dendritic cells, and then those that help to hone in and kill the tumor, the cytotoxic T cells. And SDT seems to elevate these 2 levels of cells, and this can last for a couple of months after each session. So not only is SDT itself specifically targeting the tumor cells using targeted ultrasound energy, but it also has a stimulatory effect to the immune system in a positive way. One of the problems about advanced stage cancer is that with more repeated lines of chemotherapy, the tumor can become chemo-resistant. And so whereas doing more chemo seems to have diminishing returns. Because SDT is working in a completely different mechanism, it helps to weaken the tumor cells and it helps the immune system to find the tumor cells. So it's particularly beneficial for those people who've stopped responding to their traditional chemotherapy. SDT is very well tolerated. It's gentle but powerful. Generally, we start low and we build up to as per each patient's tolerance. So as we build up, some people might feel mild tingling, or they may feel warm, but may feel hot as the immune system is stimulated. And afterwards, it's quite usual to feel tired. So we ask most patients to not plan too much on that day and to go home and rest. It's desirable to do repeated use. As I mentioned, it takes the fight against metastasized advanced cancer is not an easy one, and 1 cycle is not enough. So generally with more advanced cancers, they need repeated treatments, 3 or 4 cycles, as I say. They can take breaks in between. It doesn't need to be back to back. It can be a month or 2 in between before they do another cycle. So there is that flexibility for it.